Good day, I'm Theodore Henry, and this is your JIS News for Friday, November 29. The Ministry of Health and Wellness has purchased 36 vehicles for vector control on the government's $1 billion dengue response initiative.
I'm happy to announce that the vehicles have been procured, the 36 vehicles, they're here. We're just waiting now on the vehicle-mounted foggers to go in the trunk or the back of each of the vehicles. And in another week, I am told, we'll be able to release to the respective parishes.
The Health and Wellness Minister made that announcement during a press briefing yesterday. He says the 36 vehicles will facilitate more frequent fogging, which will help to better control the adult mosquito population. Currently, fogging is being done 1 in every 21 days in targeted areas. With the new fleet of vehicles, this will be increased to 1 in every 7 days.
That will be important because it will mean a more consistent fogging cycle.
Minister Tufton says the enhanced mosquito vector control measures are being supported by members of Parliament who are putting together plans that will complement the efforts of vector control workers in the various communities. He says the intervention being carried out by 1,000 temporary vector control workers and over 200 permanent staff will continue into the new year.
They'll be available moving around, doing house visits, giving advice, providing brochures, treating water that is contaminated or breeding mosquitoes.
In the meantime, the Health Ministry is reporting that the country is beginning to see a small decline in the number of dengue cases above the epidemic threshold. Chief Medical Officer Dr. Jacqueline Bisesa-McKenzie made the announcement during Thursday's press briefing at the ministry.
Generally speaking, from October, we have actually seen a small decline in the number of cases.
Dr. Bisesa-McKenzie reports that in January, the number of cases peaked and then gradually declined, but still remained above the epidemic threshold until about May. But with the rains in June to July, the country again began seeing increased cases of dengue reaching above the threshold level. There have been 6,792 cases with dates of onset in 2019. The data also shows 63 dengue-related deaths over the period 2018 to November 21, 2019, with most of the cases being persons below age 14. The Chief Medical Officer is expressing concern that in most of the cases that resulted in poor outcomes, persons were presented late to hospitals and when conditions were severe. She's urging persons to pay attention to the warning signs and symptoms and to seek early medical intervention.
We have put in several measures since the beginning of the year that continues in terms of the sensitization of our clinicians in terms of attending to these persons early and treating every case of dengue as being serious in terms of the advice so that persons are aware what to expect, what to look out for, what we call the warning signs. And if any of these occur, to visit their healthcare provider.
The Westmoreland Health Department is advising schools and parents to be on the lookout for symptoms of hand, foot, and mouth disease among children. Parish Health and Promotions Officer Gerald Miller says that while there is no outbreak of the disease in the parish, the department has received isolated reports of cases, hence the warning. Initial signs of the disease include fever, poor appetite, sore throat, and a feeling of malaise. These symptoms generally last for 1 to 2 days before a blister-like rash appears on the hands, feet, and in the mouth. The rash initially emerges as small red spots, but then develops into blisters, which may present on the gums, inner cheeks, and tongue. Stressing the importance of good hygiene, Mr. Miller says parents must ensure that children wash their hands regularly and use hand sanitizer when fresh water and soap is not available. He's also encouraging persons to avoid touching their eyes, mouth, and nose with unwashed hands, and for parents and early childhood institutions to sanitize toys often in order to reduce the risk of contracting the disease. The Westmoreland Parish Department has reportedly dispatched information to early childhood institutions on identifying the symptoms and practicing proper hygiene. It is recommended that students with symptoms of hand, foot, and mouth disease should be sent home for at least 1 week, and they should seek medical care. The Parish Health and Promotions Officer says that while there is no specific treatment for the disease, managing the fever and preventing dehydration should be the aim. The Plant Quarantine and Produce Inspection Branch of the Agriculture Ministry is reminding consumers and traders that the ban on imported Romaine lettuce, which was imposed in November 2018, is still in effect and has not been lifted. The advisory comes amidst reports of a recent outbreak of E. coli in the United States affecting Romaine lettuce. No Romaine lettuce is therefore being imported into the island. However, a statement from the ministry assures that other varieties and locally grown lettuce are safe to consume. E. coli poses a serious threat to public health, causing, among other things, diarrhea, urinary tract infections, respiratory illness, and pneumonia. For further information, consumers are encouraged to contact the Consumer Affairs Commission at info@cac.gov.jm or call 876-906-5424. Importers and distributors may contact the Bureau of Standards Jamaica at 876-926-3140-5 or 876-618-1534. 25,000 students will benefit from a Memorandum of Understanding, MOU, signed between the Ministry of Education and City and Guilds. Under the MOU, the City and Guilds Caribbean Office will offer certification in mathematics, English, engineering, skills proficiency awards, and customer service over a 10-year period. The Education Minister of State, Alanda Terrelong, says Jamaican students will be afforded the opportunity to receive globally recognized certification through this partnership.
I want to thank our partners at City and Guilds. The last 10 years have seen more than 40,000 young Jamaicans being educated. We have seen passes in excess of 65% as it relates to our math and English. And those are figures that at the Ministry of Education, we love those figures because we believe in an upward trajectory to ensure that the youth of Jamaica are in fact educated, because an education is also the surest path to social mobility.
The City and Guilds certification is expected to provide an alternative way for students to access higher education. And finally, Deputy Commissioner of Police Selvin Hay will be assuming the position of Chief Technical Director of the Financial Investigations Division, FID, effective January 1 next year. He's replacing Robin M. Sykes, who demits office on December 31. A 30-year veteran of the Jamaica Constabulary Force, DCP Hay will bring to the office his specialized experience in anti-corruption and major criminal investigation issues. His predecessor, Mr. Sykes, has held the position of Chief Technical Director of FID since November 2014. He's leaving to take up a new position at the International Monetary Fund, IMF. And that's it for JIS News Today. I'm Theodore Henry. Thanks for watching.